I'm the chair. What are you talking about? Good afternoon. It is 1 minute after 1, and this is the Washoe County District Board of Health meeting for Thursday, October 26, 2017. And item number 1 is roll call and determination of quorum. Madam Clerk.
Chair Jung,
Present.
Dr. Novak is absent. Oscar Delgado. Here. Dr. Hess is absent. Christopher Dare is absent. Michael Brown.
Here.
Tom Young.
Here.
We have a quorum.
Thank you very much, Madam Clerk.
Thank you.
Second item is Pledge of Allegiance. Mr. Tom Clark, would you please lead us in that?
Please join me in the pledge. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much, Mr. Clark. Next item is public comment. Any person is invited to speak on any item on or off the agenda during this period. Action may not be taken on any matter raised during this public comment period until the matter is specifically listed on an agenda as an action item. And so far, I have one person signed up for item number 3, and that is Mr. Tom Clark, and he is representing Picnic Pub and Patio.
Good afternoon, Madam Chair, members of the board. My name is Tom Clark. I'm here on behalf of Picnic Pub and Patio. And if you're not aware, and for the audience's, education, Picnic is a little bit different than what other bars and restaurants do. As a bar, they allow the public to come in, prepare their own food on grills that are provided, and eat amongst themselves. They don't sell the food out. Like if I go in a barbecue with chicken, I don't then give it to patrons that I don't know. That's their business model, and that's what they've worked on really well for the last 3 years. Since 2014, this business model has worked for them, and it's worked for the community. They've been totally in compliance. They've not gotten anybody that they know of sick. Each time the Board of Health has come to them and asked them to do something, they've done it, and they've maintained that compliance. They've invested well over $300,000 in this one property on Flint and have become kind of a model for that Midtown area. Innovative, new, young owners that really want to bring good community and stuff around their one establishment. They've got well over $1 million worth of investment in their other Noble Pie and other projects and stuff that they have throughout the community. The reason that I'm here today is that they were recently issued a cease and desist, so that the District Board of Health came to them and said, I believe that they may have been not in compliance on one small matter. They were given the cease and desist, and their whole business plan is now shot. People that expected through the holidays and stuff to be able to go to Picnic, do their celebrations with their family, cook their own food, prepare their own food, buy the liquor and stuff from the bar, the establishment, now no longer can do that. There have been comments made that, well, you could stock the freezers and the fridges and stuff and sell the food that then people could prepare. Well, it's a hit or miss. They would have to stock an inordinate amount of food to be able to be ready to meet whatever menu items that are there, and that's really not their business model. They're not a restaurant. They're a bar that provides a service to the public to come in, prepare their own food, eat it while they imbibe, have their cocktails and wine, whatever else that it happens to be. It's sending a message through Midtown, this cease and desist does, that you come in as a young company, you make the investment, you follow the rules, and then you're told cease and desist. Now, compliance is one thing that we all deal with all the time. I understand that. What I'm asking for today is that the Board of Health not enforce that cease and desist until we can all get into a room and figure it out. There's a lot of innovative, unorthodox new restaurants, new businesses coming in to the core of downtown and around downtown Sparks, the county. If the regulations aren't crafted and drafted to meet that innovation, it's going to send an even clearer message that the City of Reno, Washoe County, the City of Sparks doesn't want those new types of businesses. And I think we can all agree that innovation really is what we're all about in this community, in the Truckee Meadows. I ask you that you please not enforce the cease and desist. Let's get together. You've got a retreat coming up in November. Maybe it's an agenda item, not about my client, but about all of the innovative types of service, food service especially, and public safety that comes along with that, that you're governing. Let's come to a place where we send the message to these businesses, existing and the new ones, that we're not just going to come in and shut you down, whether it was a minor incompliance or, you made one mistake. We're not just going to shut you down. We're going to work with you. We're going to make sure that the public is safe, that the public health is safe. And these kinds of businesses, these kinds of investments can continue to affect downtown, midtown, Washoe County, Sparks, and others.
Thank you very much, Mr. Clark. That takes us to, first of all, let me ask, is there any other public comment?
Not,
Okay, thank you. We will close public comment and go on to agenda item number 4, which is the approval of today's agenda.
Make a motion to approve.
Motion by Brown, a second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. District Health Officer, why don't you take it away?
Thank you, Madam Chair. Next, we have recognitions and first years of service. Holly McGee with 25 years of service. Unfortunately, Holly is not able to be with us today. So, yeah, she's busy with the TB clinic off-site. So, after 25 years, still working in a dedicated manner for the health district and our community. Next, we have new hires, and very pleased to introduce you to Katrina Peters. And Katrina, if you could stand to be recognized and stick around because we'll be doing pictures, and actually I guess you have an agenda item later today. Ms. Peters joins the Office of the District Health Officer as our new Director of Programs and Projects. You may recall Sarah Bale, who was in that position previously, and understanding that, you'll know that Ms. Peters has a lot on her plate, and she comes to us most recently from the Department of Agriculture. Before that, the Department of Education. She was the manager of the school meals and nutrition program for the state. So that program transitioned from ed to ag during her tenure there. She has an undergrad degree in nutrition from UNR and a master's in nutrition from Purdue University. So welcome to the Health District. We also have a couple of new employees with CCHS, Susanna Contreras, and Mr. Cutts, would you like to do an introduction for Susanna? Susanna.
Do I need to?
You're ready.
Okay, good. Okay, cool. Good afternoon, Madam Chair, members of the Board of Health. Steve Cutts for the record. With me this afternoon, I have Susanna Contreras. She is our new office assistant too, and she's currently assigned to the immunization program. She comes to us from Renown Health with 17 years of experience with customer service, billing, insurance claims appeal, and call center experience. And we are very excited to have her join our team.
All right, and we'll do pictures, Mr. Cutts, if you'd like to stay there. Our next introduction is Sophie Bonspach, who is a CDC associate, and the board may recall we've been successful over the past few years in getting CDC public health associates that come to us basically as free staff that the CDC is paying for, and we really love having them with the health district. I'll let Mr. Cutts provide an introduction.
All right. This afternoon, I have Sophie Bonspach with me. She is our new Public Health Associate through the Public Health Associate Program with CDC. She is also assigned to the immunization program, and we will have her for 2 years. She has a bachelor's degree in fine arts in scientific illustration and a certificate in global health from the University of Georgia. And we are excited to have her with our program, and we love having the Public Health Associates. They've added a lot of value to our organization.
All right.
Welcome to everyone. I
Should we do
love that
pictures?
we're going to do pictures, and I love that it's, no offense, this masculine board that I serve on, it's all women, and I have to point that out. So let's go by the agenda, Katrina, then Susanna, and then Sophie, okay? We're going to take photographs. First and over second. Thank you. Oh, he did? Welcome aboard. Susanna? Yeah. Am I right?
Sophie.
Good to meet you. So lucky to have your friends here. Thank you so much for having me.
How are you finding Reno?
I love it.
It's a lovely place. Welcome aboard. Congratulations.
You can teach these too.
Thank you. Again, congratulations to Ms. McGee, who has 25 years of service here at the Board of Health. And then I want to congratulate our new hires, Katrina Peters, Susanna Contreras, and Sophie Bonsbach. And I hope you have a long and successful career here at the Board of Health and Washoe County in general. Welcome. Mr. Manager, Mr. District Health Officer.
Thank you, Madam Chair. Next, we have the consent items, matters which the District Board of Health may consider in one motion. Any exceptions to the consent agenda must be stated prior to approval.
Does anybody have anything they'd like to pull out of consent? Is there any public comment?
Not at this time.
I would entertain a motion.
I move to approve the consent items.
Thank you.
Second?
I have a motion by Mr. Young, and a second by Brown. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 7, Mr. District Health Officer.
Thank you, Madam Chair. We have a presentation and update on Community Health Alliance by Mr. Chuck Duarte.
Just make sure that I'm offline here. Hate my phone ringing while I'm in front of you folks. So I will take the Secretary's advice, and it says just slide the button? Just slide the button. Okay. Oh. Okay, we'll see if this works. So thank you very much for the opportunity to be here today. For the record, my name is Charles Duarte. I'm the CEO for Community Health Alliance. And through that organization, I have the opportunity to work both with Kevin and with Oscar Delgado on an ongoing basis. And it's a real privilege to be a part of the health community here in Washoe County. Before I go on, just by way of background, I've been in healthcare since college, since my early days in Hawaii, growing up there in the healthcare system, which is only just a couple of years ago, actually. I look a lot older than I really am. But I had opportunities to work in the clinical laboratory business and in hospitals and even in Medicaid managed care before being asked by the governor of Hawaii to run the Medicaid program there, which I did for 3 years, and then moved to lovely Truckee Meadows in 2000 with my family to run the state Medicaid program for 12 years. And so I have some background in healthcare financing and healthcare delivery systems that I bring to my experience now with Community Health Alliance. Community Health Alliance is what I like to say, it's the largest nonprofit that no one's ever heard of. A lot of people are just beginning to find out what we do and who we are, and so I like to take these opportunities to tell folks who we are and how we can help the community and how we're helping the community on an ongoing basis. So we will see if this works. That didn't work. That didn't work. I think I might need your help. I'm sorry. I'm technically inept. Okay, thanks. So like I can just hold up the high sign? There you go. Okay, good. All right. So CHA. So yes, we are a nonprofit here in Washoe County. We are a community health center, which means that we are a federally qualified health center and do receive some federal grant support to serve the underserved and the homeless. In terms of our core services, we provide primary medical care, dental, behavioral health, and many other additional services. Copy of our mission here. So we really are here to provide affordable care for people that can't afford it and don't have the means to pay. And so we do everything we can to make our services available. We're not a free clinic, but we have a sliding scale that we offer to people who don't have insurance. So I was mentioning that a lot of people know us by our old name, and it was HAWK, the HAWK Community Health Center, which started in 1995. It was founded by the Washoe County Medical Society in that time, and then it merged in 2012 with the St. Mary's Mission and Outreach programs. So when St. Mary's was getting purchased by Prime Health, the for-profit corporation, they needed to discharge their not-for-profit entities, and it was a perfect merger for us. And so they basically just transferred the employees, all the assets, all the leases, and everything to us. And we were very grateful because it fit in perfectly with the mission of HAWK, and we formed a new corporation called Community Health Alliance. So today we have 6 health centers located throughout the county, serving residents of the county. And so if you look farthest down on the bottom of the map, that's our Neal Road Health Center at Miguel Rivera Park. We're sitting on city property there. We're grateful for the opportunity to serve the public there. A little bit farther north is our Wells Medical Dental Center, our largest health center. Right next door to that is a specialized health center we call the Center for Complex Care, where we have patients receiving more intensive services for chronic disease and behavioral problems that they might have in managing their chronic conditions. A little bit up farther north in Midtown, we've got our Record Street Health Center located on 4th and Record. It's in the Community Assistance Center serving the homeless. And we recently just had that re-grand opening there. We've added a dental operatory, and we've seen quite a few patients coming in for emergency dental care there. But our mission there is to serve primarily the homeless. And then our newest health center is up in Sparks. It's our Sparks Health Center, good name for it. It's on Audie Boulevard, right next to the United Cerebral Palsy thrift store, across the street from the Kmart shopping center. And then way up in the North Valleys is our Sun Valley Health Center.
What's that address?
Excuse me?
The address?
Where is Sun Valley Health Center located at?
I don't have the address right at the top of my head.
Or is it standalone?
It is standalone, and it's right on Sun Valley Boulevard.
Gotcha.
And
Sorry.
I wish I had the address
it's okay.
handy in my
It's
head,
okay.
but I don't.
I was hoping you were going to say it was at the GID's place or the community center.
No, it's actually across the street from the Scolari Shopping Center.
Gotcha.
There's a dental clinic.
Yep.
Dr. A
district.
owns the dental clinic? Yeah.
Yes.
Okay.
Thank you.
And then one of the things that we've been doing besides, focusing on quality of care is we're using a team approach to medicine, and we're implementing this throughout our entire health system. And simply put, what this does is it allows our physicians and our mid-level practitioners in primary care to work at the top of their scope of practice in order to see as many patients as we possibly can. Because the key to improving population health and serving a larger part of the community is getting patients into care. If your schedules are closed up, you can't do that. And so we're trying to keep our schedules as open as possible, be as efficient as possible. And we think this achieves the quadruple aim, which I'm sure you folks have heard of the triple aim. The quadruple aim is to improve provider satisfaction, and that's another key to this. So this is just some quick facts about our organization. So we serve about 30,000 unduplicated patients and clients. And so, currently we have 26,000 medical patients. We have overlap with our dental patients, but we also have a 5,000 member WIC program, and we partner very closely with the county WIC program. Our model is a little bit different. We have WIC services available in all of our health centers, as well as standalone WIC sites and a mobile van that brings WIC services out to the community. So our services tend to be a little more distributed than the county WIC program. We've had 90,000 annual patient visits last year, and a high percentage of our patients call themselves or register in as Hispanic. About half of those who register as Hispanic have English as a second language, and so the majority of our staff are bilingual. And then, of course, a large number of our patients are in Medicare and Medicaid. And surprisingly, a lot of our uninsured at our Record Street Health Center have Medicaid as well, which is a great thing. And so if you see the statistics there, 20% of our patients remain uninsured despite the Medicaid expansion. So that number has gone up. So as of today, it's 280 staff. As I mentioned, about 70% are bilingual, and we have 50 licensed clinical professionals of all types. Physicians, mid-level practitioners, so APRNs, physician assistants. We have nurses, behavioral health providers, dentists, hygienists, pharmacists, and dietitians. So again, our primary services, primary medical care, our WIC nutrition services, behavioral health, pharmacy, and primary dental care. In terms of medical services, we do soup to nuts. We do just about everything with a focus on prevention. The one thing we don't do is we don't do obstetrics, and we have a very close working relationship with the renowned pregnancy center and use their services predominantly for OB care. We have been sending our pregnant women to St. Mary's as well. They're reducing their services to Medicaid clients, so it's a little more difficult for us there. And then, of course, our WIC program, and we're very proud of the WIC program. They've done such a great job. It's such a great group of people, and they're really happy to be doing the services they're performing for our clients. They're the happiest crew we've got on staff, and I say if I could add puppies and cookies to babies, it would be the perfect healthcare program right there. They make everybody happy. Behavioral health, and so we have behavioral health services in our centers, and we do it slightly differently. Right now, we're not treating people with a serious chronic mental illness. We don't have the capacity to do that, but the model that we've implemented is something called integrated care. And the focus of integrated care is to have a behavioral care provider work with a primary care provider on helping patients achieve better health. And so if you have diabetes that's uncontrolled, generally you've got anxiety and you've got depression associated with that. And so we try to address those issues in order to improve compliance with their chronic disease management and self-management. So things like smoking cessation, overeating, anxiety disorders, substance use disorders. We try to intervene in those cases in very brief interventions and not drag the patient through a long series of therapy sessions. If they do need long-term therapy, we work with other partners in the community to get that. We have an in-house 340B pharmacy. What that means is we get the best price, one of the best prices in the nation for our drugs, which we pass on to our patients. And so we have a pharmacy located at our Wells Avenue Medical Dental Center, Record Street Health Center, and we will be opening one up in Sparks. One thing I should mention about the pharmacy program, you don't need to go back to it, but we're actually training our pharmacists to be clinical pharmacists, and so they're working directly with our primary care providers on the treatment of diabetes, and hopefully in the near future on using drug regimens for blood thinning. Our Healthcare for the Homeless program, I'm sorry, you're doing really well, though. Our Healthcare for the Homeless program, again, is focused on Record Street at our health center there, but we serve homeless individuals at every one of our locations. And if somebody registers as being homeless, living in a shelter, in transitional care, doubling up, whatever it might be, transitional shelters, I should say, we register them as homeless. And they're eligible for these services if they don't qualify for Medicaid. And so you can see there, everything there is free for them. Primary medicine, immunizations, lab services, family planning, prescriptions, dental services, and behavioral health care. And then we have added dental services, and we are working very closely with the VOA at the Community Assistance Center on Record Street. So for dental services, I mentioned that we do primary dentistry. We work with community partners on specialty care like oral surgery, endodontics, periodontics, but we do just about everything else for kids all the way up to seniors. We have 3 permanent locations providing dental care, so our Wells Avenue Dental Center, our Sparks Health Center, and our Record Street Health Center. And all told, we have 24 fixed operatories that we work out of in those 3 facilities, with 18 operatories located at Wells. But we also have a mobile outreach program that serves the community, and one of the programs we run is our adult mobile outreach program. And so we have a dental van with 2 operatories that goes to a number of locations, including the senior center that's run by VOA, the pregnancy center at Renown, and then the Renown Healthcare Center, which serves a Medicaid population on Locust Street. But we also have our van going to Crossroads, and so we're serving the residents of Crossroads. And then we have what we call our cavity prevention program, and so that program, one of our vans with a hygienist, goes to 27 Title I schools. And what we do is we try to treat teeth in a preventive way, and so we work with 2nd graders and 5th or 6th graders in those elementary schools to put sealants on their teeth, give them fluoride varnish, and give them oral health and nutrition education so that they don't get cavities on an ongoing basis. And then these are just a list of some of our additional services. So one of the things that we're really proud of are some of our health and wellness classes. We have a pediatrician working for us named Dr. Steve Shane, and he's appeared at the Truckee Meadows Healthy Communities Coalition several times. But he started a healthy weight program for kids who are obese or near obese. And it's a clinical program, 12 sessions with the family. It's multidisciplinary. It involves Dr. Shane, a clinical psychologist, a dietitian, and then staff support to teach families better habits and to teach them the rules of 5210. And that's the messaging we give across our entire system to families. 5210, it's real simple. 5 servings or more of fruits and vegetables, no more than 2 hours of screen time, 1 hour or more of exercise, and 0 sugary drinks. 5210. And we would love to promote this throughout the county at any location we can. We would do it for free. We just think it's the best thing that we could do in order to prevent the epidemic of diabetes and obesity in this county. If we could at least start bending the curve on education for families. And there are a variety of different ways that we can do that, working in collaboration with our WIC programs as well as the schools. And so any opportunity that we have to promote 5210 would be very, very welcome. Next, please. We do coordinate for transportation services for our patients. And next. And this is the Healthy Weight Program. And I think I'll end my presentation there, only to say that, you know, we are a part of the healthcare community here in Washoe County, and I think increasingly it's becoming more and more fragile. And a lot of that's due to the fact that there's some things going on, regardless of your politics, there's stuff going on in Congress that are creating a sense of chaos amongst healthcare providers and patients here in this community and across the nation. And I think we have to advocate as healthcare professionals for good policy. And you know, I look to the Board of Health as one of those organizations that can advocate for good policy, because you know, without things like an extended Medicaid program that was the result of Governor Sandoval's efforts to improve health care in Nevada, we have an opportunity to really take advantage of that and improve health. But if that gets cut, or if public health programs like immunization programs get cut, which the threat is there, or funding to health centers like ours gets cut, which again is threatened, we're going to be a lot worse off, and the residents of Washoe County are going to be much the poorer for that in terms of health and wellness. So with that, I'd be happy to answer any questions.
Thank you very much, Mr. Duarte. Does anybody have any questions or comments, or Councilman Delgado?
No, if anything, just invite the community and the board to tour one of the several different sites. Nothing says more than actually going and seeing, and of course seeing the great providers that do the great care here in our community.
Anybody else? And I will absolutely take a tour. I'll take
Please
you
do,
up on the
yes. And
tour.
anybody in the audience, too.
Anybody in the audience?
Yeah.
Anybody at home watching that would like to?
Give me a call. I think there's information on, my contact information is here on the last page, but I'm happy to set that up and have people see what we do on an ongoing basis.
Can I make one?
The district health officer would like to speak to that, but let's get the contact information up, please.
There you
we
go.
go. Thank
Yeah.
you.
I just wanted to thank Mr. Duarte for his leadership at Community Health Alliance, but also for his strong participation on the steering committee at Truckee Meadows Healthy Communities, and stepping up and really contributing to and supporting the Family Health Festival events, the RAM event that we held recently, and working tirelessly to advocate for access to health care for people in our community. So
Thank you, Kevin.
I agree. I do have some questions.
Please.
When you say that if the issue for the behavioral health management is larger than what you can do, and you said you send them to partners, other than the Children's Cabinet, what partners do you have here locally?
Well, unfortunately, those partners are quickly disappearing. And so that's a huge problem for us here in the community. So for example, Northern Nevada Adult Mental Health Services is cutting back on their outpatient behavioral health care. Mojave Mental Health, which is a subdivision of the University School of Medicine, is going to be closing. And so for people with serious chronic mental illness, it's a huge problem. For children and adolescents, it's even a bigger problem. And so the issue for us is really nobody's here to help serve those patients. We had a recent mayor's conference here last week on behavioral health, and one of the physicians was here, Dr. Jeremy Matusak, and he was talking about the same thing, that we have a serious problem here in Washoe County. And so we do depend a lot on, if people have Medicaid, we depend on those Medicaid managed care plans to find somebody. And even with that, they're struggling. You know, insurance companies don't grow psychiatrists. I wish they did. It would solve all our problems. And so we have a number of partners we work with, including Northern Nevada Hopes, a fellow community health center here in Washoe County, but their capacity is limited. So the problem is not easy, and it's not going to go away, and it's going to depend on action and advocacy by organizations like this, boards like this, as well as the general community, to increase funding for mental health across the board, and to ease some of the licensing restrictions that keep good practitioners from coming into the state.
I agree 100%. Actually, the largest provider of mental health services is the Washoe County Jail.
And that's a sad statement to make.
And it's not really a service.
Yep.
It's not what mentally ill people need.
Correct.
You mentioned that people who are homeless are eligible for a litany of free services, and I wonder if you have partnered with the Eddy House, which is the youth homeless?
Yes, in fact, I reached out to them 2 weeks ago to see what we can do to provide primary medical care for their clients coming in. So I'm waiting to set up a meeting with them. We've extended the offer to them and other organizations serving the homeless and homeless youth specifically to be a referral source. And in fact, we're working pretty closely with Amber Howell on the services provided by the county, and particularly for, pardon me?
No, it's okay.
Oh, I'm sorry.
Focus here.
And particularly for children in foster care. And so we're a primary referral source for them as well. But yeah, our doors are open to treat kids, and we've made active offers.
I just want her to be able to know that she can send these
16
to 24-year-olds over there for that whole, I mean, you have the sexual health, vaccinations.
Yep.
I would guess that many of these young people that are homeless have not had that kind of treatment.
And I've made that offer to
Okay.
Michelle, who
Great,
works
yeah.
over there.
Okay,
Yeah.
great. And then, did you say that this is a sliding scale fee for service, and how do you slide the scale?
So the slide's based on income.
Okay.
And we have 3 different slide levels. And what we do is, every time a patient comes in, we assess their eligibility for Medicaid, because that's really the go-to. We want to get these folks on comprehensive medical coverage, and Medicaid is the way to do it. And so we screen them intensively for Medicaid, and we have in-person assisters that work with those patients to get them signed up for Medicaid as soon as possible. And, but if they are not eligible for Medicaid, or the Silver State Health Insurance Exchange, which is our Nevada exchange for insurance, or any other programs, what we try to do is to find options for them. And one is access to health care. Access to health care runs discount medical and dental programs for people that aren't eligible for Medicaid. And we're probably their largest referral source for clients. And so we try to sign them up for that. And then if they don't meet that qualification, and they truly are uninsured, uncovered, and they want to access our services, then services costs are based off a sliding fee. So for example, for most people, we slide our fee down to $40 for medical care, and that includes a medical visit, that includes any vaccinations or medications, or
What about dental?
Dental is a
an
separate
area that
sliding
we have,
scale.
Yeah, and there's a gluttony,
yeah,
a
and
glutton of a lack of service.
There is.
And most insurance don't pay for.
And so
So how
what
does
we
that
try to
work?
do is, we try to, we have a sliding scale for some services. But most often, when we have seniors and adults coming in to see us as new patients, their needs are pretty extensive and generally pretty expensive, and often require referrals out to specialists for things like oral surgery. And so what we try to do is, we try to put together a payment plan for them that enables them to be able to afford it. The problem we're having right now is that we're the only game in town for adult dental services for people who don't have dental insurance. And so our capacity is completely full. And it's kind of sad, but our next available appointment for new adults is way out in next year. But we're trying to increase that capacity and find ways for us to afford to pay for adult services. So we try to make it as affordable as possible. In some situations, we have a patient needs fund that we fundraise for. And to give you a quick example, we had a patient come in who needed 14 extractions. He had leukemia. He was awaiting a bone marrow transplant. We were able to raise $5,000 to send him to an oral surgeon to get the surgery done at Renown in their surgical suites, because he had a risk of bleeding. He got that done, and then the nurses at the transplant center at UC Davis were going to pay for his dentures. So another $5,000 for dentures. Unfortunately, the gentleman passed away, but that's the kind of thing that we have to do sometimes. And we do have a small patient needs fund if people have no way of affording care but need it.
That's wonderful. Finally, do you take all insurance?
We take all insurance.
It's good to know. Okay, and what I always ask in a situation like this, let us know how we can help. And one way that I think we could, and I don't know, and so you tell me how you want to go with this. Not so much of you doing outreach, because I bet you people are banging on your doors. I don't think you're probably like us with senior services, which is we have a waiting list because people are well aware of us, so we don't advertise. But your 5210,
Absolutely.
I would be happy to have our production crew make you a PSA.
Oh, that'd be wonderful.
And then we could just blast it to all the stations, including this one. But that's a great lesson for parents and for grown-ups of this is how you're going to combat this. So
It works at all ages.
so let's circle back and we'll get that produced. We have a great production crew here that are we contract out to, but I'm sure we can swing even the money to get that done.
Thank you. That'd be much appreciated.
We'd
Thanks
love
so
to do it.
much.
Thank you for what you do. I truly think it's what keeps this community a community that people want to live in. And your job is truly biblical, and I'm not even religious, but I do believe it. It's exactly what we are supposed to do as human beings.
When I left state service and came to this job, I did have to go to confession to repent for all my sins in state service. But
Good for you. I'm glad
yeah.
you have that release.
I'm forgiven now.
Okay, good.
Thank you.
Thank you. Mr. District Health Officer.
Thank you, Madam Chair. Next, we have item 8, the Washoe County Food Policy Council updates and accomplishments. And we have Leah Tauschen and Kelly Goatley Sales.
Good afternoon. My name is Leah Tauchen, and I am currently serving as the chair of the Washoe County Food Policy Council. The council is a volunteer public-private partnership bringing together representation from all sectors of the food system for networking, collaboration, and promotion of access to healthy foods. We were established by the Washoe County District Board of Health in 2011 to help implement the Washoe County Food Plan. Our mission is to support a vibrant, healthy, and equitable local food system. Put more simply, our goal is to work toward reducing barriers so that all residents in our community have access to healthy foods. The council is currently comprised of 7 members, and we have 3 applicants pending. Our bylaws do allow us to get up to 12 members, so if you know anyone that would like to join us, we do have a couple of slots open. Again, we operate as a volunteer board without staff or an operating budget. So we're very fortunate. We're able to meet at the Washoe County Complex, and then we're also very grateful because we have Kelly Goatley Seals from the Health District's Chronic Disease Prevention Program, and she assists us with administrative duties. The council meets monthly. We often have guest speakers that we learn from and we collaborate with. We have also met with local farmers and taken tours of their farms. We actively seek opportunities to examine and improve food policies. So we monitor food-related issues at the local, state, and federal levels. Locally, we monitor the agendas for the Reno and Spark City Councils, the Washoe County Commission, and then each of their planning commissions. We also look at this body and the Truckee Meadows Regional Planning Agency. So more specifically, recently, council members have participated in community meetings and planning activities for both the Ignite Sparks Comprehensive Plan and the Reimagine Reno Master Plan. We've provided language suggestions related to food access, of which many were accepted and incorporated into their draft proposals. We anticipate contributing to the Regional Planning Agency as they begin updating their plan as well. And then last year, the council actually presented a Food Day proclamation to all 3 local municipalities to encourage residents to enjoy healthy eating by incorporating more real foods into their diets. At the state level, we follow the Board of Agriculture, the Governor's Food Security Council, and other state agency meetings. Then during odd years, we do track bills at the legislature. Some of our more recent accomplishments in this realm include successfully proposing language for the Nevada Housing Division's 2017 Qualified Allocation Plan. The division actually amended their plan to include our recommendations related to community food growing areas. And then at the 2017 legislative session, we did identify several key policy issues. We tracked and followed those bills, and we submitted written comments during those hearings for the record. So some of the bills that we were engaged on regarding urban agriculture, school gardens, and then food services for seniors. We also stay up to date on federal initiatives. Currently, we're monitoring the fiscal year 2018 federal budget and its impacts on programs like SNAP and Medicaid. And then we are actually going to be meeting very soon with congressional delegation to discuss the Healthy Breakfasts Help Kids Learn Act. So there are many positives with what we're working on, but I would be remiss if I didn't update you on the challenges that we face as well. We lack funding and resources, and we struggle with member engagement and recruitment, just like most volunteer boards. We understand that everyone is strapped for time and pulled in many different directions. Plus, there are many competing organizations out there, many of which have very similar goals as we do. So the bottom line, the Food Policy Council wants to strengthen our regional food system and ensure that it is sustainable. So from a policy perspective, we would offer you our assistance. We have examples of model policy from across the country, and we're able to provide research if and when food issues do arise. Like everyone in this room, we want to work together to make a meaningful and long-lasting difference and provide for a healthy future for Washoe County residents. So thank you again for your support.
Thank you, Ms. Tauchen, and thank you for being there from the day we put this board together and supporting it so well from your position as a lobbyist and government affairs director with the Retail Association of Nevada. We appreciate that.
Thank you.
Do you have anything you'd like to say, Ms. Goatley Seeley? you.
No, Kelly Goatley Seals for the record. Nothing to add. Leah does a fantastic job, so just here to lend support as well as help answer any questions. The Washoe County Chronic Disease Prevention Program has been involved with the Food Policy Council since the inception.
Yes, and you were the originator, and you're the one that executed the grant that gave us the ability to, it didn't come to you, that gave us the ability to identify that this was an area that we needed to address childhood and adulthood obesity. I will take it to the board. Do you have any questions or comments? Or I have some questions. I want to know how closely you work with or are aware of the Reno Gleaning Project. That might be somebody, the woman who runs that is, of course, now I can't remember her name, but you can look it up on Facebook. Her name is Pamela Maines. And what they do is a volunteer project, and they go out and harvest people's fruits and vegetables that they can't get to at the end of the season or during the season. And she came herself, and she and I had just a bumper crop year of nectarines. And so those were all taken, and the ones even on the ground she took, because the Girl Farm out and north of us here in the county, they feed that to their hogs. And then she picked a ton of my Concord grapes, which I don't like, and all that food goes to the Boys and Girls Club. It's washed, and then they take that there. And I think she would be somebody to get on that board as soon as possible, because she has single-handedly created this. At the same time, she's a Pfizer pharmaceutical rep, so she runs all over the place. So if you could maybe contact her. I had told her about you as well when she was at my house. So I know she's ready, willing, and able to do this, and a real knowledge base.
That's fantastic. Thank you for the suggestion.
You're welcome. And then, do you work with Regional Planning Governing Board to make recommendations on projects of regional significance?
We have actually had them come speak to us, and so we are hoping to work with them going forward. We know that they're in the process of updating their 5-year plan, so we plan to participate just as we have done in Reno and Sparks.
Great, and we want that food policy issue in there in terms of development and avoiding food deserts, and however we can incentivize people to even come in and build a grocery store in a food desert. But mostly, let's just avoid the food desert, right, with new planning. And then you said you have no funding or resources. What kind of funding and resources is the best practice? If you can't answer it today, it's okay. Just get back to me. How much are we looking at? What does the best practice across the country? And what would you envision that money to then provide? Just write me a proposal and see if we can figure out a way to fund this, because I think we can do it.
Yep, we will do some research, and we will look at some other food policy councils across the country and communities of our size, and get some more information for you.
Because I would argue the reason why you don't have member engagement and you're hard to recruit, what can they do if you have not even a project that we could fund? Do you see what I'm saying? I think if you had the resources and money, people would clamor to get on that board, and people that this is their passion would be on that board. So just write us a proposal, and we'll take a look at it and see what we can't provide. The health district doesn't have any money, but other people have money in this community, including the county. So, and we're really, we pay the price at the county level of diabetes and, all of these food issues more than the cities do, because we take care of indigent people.
Sure. No, thank you very much. Appreciate the offer, and we will get back to you.
Okay, great. Thank you. Any other questions? Yes, Councilman Delgado.
Thank you. Leah, it's good to see you. I know we had met previously regarding the food policy, and again, this is great to see that you guys are making headway on a lot of your different fronts. I see here on the bottom on recent accomplishments regarding the Reno Master Plan. Did you guys find that as meaningful in the sense that the city was open to having that dialogue and getting some language in part of the Reno Master Plan?
Yes, very much so. We're very appreciative of the community outreach meetings that were held. Were, I think, very helpful. They allowed us to provide our insight and some of the suggestions that we had taken from other communities in the country, and so most of them were actually incorporated into the draft policy that I know you'll be seeing before your council soon. Since it just passed through the Planning Commission. But yeah, we're incorporated, especially, I think it was Initiative 7, which is the sustainability, so that's a perfect place for some of these food access issues, right where they belong.
Awesome. And I know with your heavy background and working with business, it's great to have you as a bridge between trying to make that conversation take place in terms of bringing a certain type of business into those food deserts, as we saw the closure of Sack and Save right off of Plum, and now what that's generated in terms of a food desert for many of those community members there now. the conversations that is possibly going to be turned into a auto sales piece. And so good for business, but also now bad for health, right? So talking about what that means for our community is valuable. Again, thank you for your hard work.
Thank you very much.
Anybody else? Thank you so much for your time and efforts, and get back to me with that proposal. Okay, thank you. That takes us to item number 9, Regional Emergency Medical Services Authority. I do not see J.W. Hodge. This is 9A, Review and Acceptance of the REMSA Ops Report for September 2017.
Good afternoon, Madam Chair, members of the board.
Hi.
Mr. Dow is out on a personal trip today, so he wasn't able to make it, and JW will be back next month. So,
State your name for the record, please.
Paul Burton, Director of Operations.
Thank you.
You guys have received a copy of the September compliance report, and I'm available to answer any questions if you have any.
Does anybody have any questions from the compliance report? Okay, I do have public comment, and this is Ms. Kathy Brandhorst, and this is for the REMSA compliance report, item number 9. 9A, I'm sorry.
My name is Kathy Brandhorst, and I am the United States President. I just saw the laser beam trying to pick up my dolls right off the floor. That's not a very good item, you know, to be doing, to be stealing my dolls.
Ms. Brandhorst, item number 9 is review and acceptance of the REMSA operations report.
Yes, I know. You also excluded me from number 8, too.
Number 8 was not an action item, so there's no public comment.
Oh. REMSA is still working very hard, 24 hours a day. I still hear the sirens going downtown. Also, I've been sleeping outside, and I've been listening to all the REMSA's. Scotty's body was found again last night. He is the new tenant for my apartment, so I had to move out by Monday, and that was this week. But he's also been found splattered even 2 hours before that happened. And my doll, that's my doll, splattered all over the street too, because he knew something about somebody, and so they had to grab him in the middle of the night and splatter him all over the place. I just wanted to let you know that there are now 32 people going in those elevators, and they're all sleeping in their cars up there on the 2nd floor, I heard. It could be the 3rd and 4th floors also.
And this has what to do with REMSA's operation?
The homeless I'm talking about.
Okay.
I don't know why anybody would allow them to sleep in parking lots in their automobiles. And I just wanted to tell you, too, that, again, a few hours after the splatter of little Scotty, then his body was found again, and this time he was so thin, I did not even recognize him, and very, very old. Oh, my. There was a little girl, she was running down the street, she was scared to death. And later they found her body, and she's only 4.5 years old. She was raped, and she was killed just instantly. She was murdered. Oh, my God.
Thank you, Ms. Brandhorst. Is there any additional public comment, Madam Clerk?
Not at this time.
All right. Seeing that there are no questions, I would entertain a motion for item 9A.
Motion to approve.
I have a motion to approve by Brown, second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Now we are at item 9B, which is a non-action item, and this is the update of REMS's public relations during September 2017.
Thank you, Madam Chair. Mr. Romero gave you a pretty detailed report last week, and I really don't have any for items to report for this month, so.
Okay. Does anybody have any questions?
Questions?
Thank you very much for being
Thank you.
here. Appreciate it. All right. Mr. District Health, Mr. District Health Officer, you want to take item 11?
Thank you, Madam Chair. We're actually at item 10.
10, sorry.
Regional Emergency Medical Services Advisory Board, October meeting summary. We have Ms. Brittany Dayton presenting on that today.
Good afternoon. Brittany Dayton, EMS Coordinator on behalf of Christina Conti. The quarterly Regional EMS Advisory Board meeting was held on October 5th, 2017. Your staff report is included in your packet and has a summary of the items discussed. However, I would like to highlight 3 items. First, the board heard a presentation and approved for distribution the Washoe County EMS Oversight Program Annual Data Report for fiscal year 2017, which was attached to your staff report. Second, the board received information on the map methodology used to review the REMSA franchise map, and the EMS Advisory Board staff report was also attached to your District Board of Health report for your information. And finally, I would like to highlight that the board heard an update on the EMS Strategic Planning Objective 5.1, which was to create a set of regional EMS protocols. These protocols will be utilized by 8 EMS agencies within Washoe County, several of which will begin implementing in January 2018. And with that, I'd be happy to answer any questions.
Thank you, Ms. Dayton. Does anybody have any questions for the Regional Emergency Medical Services Advisory Board meeting for this month? Doesn't look like it. This is not an action item. So thank you for being here. Mr. District Health Officer, item 11.
Thank you, Madam Chair. This is a review, discussion, and possible direction to staff to discontinue collection of information regarding certified food protection managers at food establishments in Washoe County. And I'll take the lead on this one as the acting EHS Division Director, but we also have Mr. Macaluso here. This item is a result of the board meeting that we had back in May of 2015 when the board adopted new food regulations. And those regulations included eliminating the somewhat prescriptive requirements that we had for training required for certification as certified food protection managers. During that board meeting, there were concerns expressed about how this would work and whether we were going to have a number of people that were now failing the certified food protection manager exams that occur at the national level, and a request made that we track what was happening with failure rates as we inspected businesses with employees there that had taken the exam, and tracking certified food protection managers at those facilities. As a result of that work and that data collection, we found that there was a 3% failure rate from the information that we collected, so very low level of failure rate from people taking the exam. In those instances, the establishments either had them retake the course or they had somebody else take the course. So we saw very little impact from the elimination of our local training requirement. And so as a result, our recommendation to the board is to provide us with direction to stop, to discontinue the collection of that information that had been doing during our inspections.
Anybody have any questions? I don't think any of you lived through this. I did. Oh, you did? Okay, great. Okay, great. Is there any public comment? There is not. So I would be looking for a motion. This really cleaned up the integrity of this food program, and we took a beating publicly because people were making money teaching these programs. So I'm happy to put this to bed. This is actually much more modern and moving us into the 21st century in terms of how we handle food handling. And you're the food handling expert, so you probably should make the motion.
Well, I do move that we accept it, move that we accept this issue.
Thank you. I have a motion by Young, a second by Brown. Any further comments? All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. District Health Officer.
Thank you, Madam Chair. Item 12 is presentation and acceptance of the FAB, Public Health Accreditation Board progress report and timeline. And this is my newest employee, Katrina Peters.
Good afternoon. Katrina Peters for the record. Thank you for your warm welcome. I'm very excited to be here and serving under the direction of the District Health Officer and the board. I'm here this afternoon to give a brief update.
It's okay.
Do you want me to
Just
move
keep
this a little
talking.
closer?
A little closer. You're just soft-spoken.
I'm here to give a brief update on our pursuit of public health accreditation. Let's see if I can get this clicker to go. All right. So to just really kind of briefly recap the history, the board approved our pursuit of public health accreditation in June of 2016. And we also have completed quite a few of the more substantial required documents to pursue accreditation. They require that we have a strategic plan, and we've completed that, a community health needs assessment, and a corresponding community health improvement plan, and those have both been completed and published. Thanks to my predecessor, Sarah Beal. She developed a great accreditation team, and all of those team members have undergone training on the accreditation process, so they understand the basic elements. A team member from each division within the health district was identified to kind of get representation across all divisions. But due to some staff turnover in the summer, there was a little bit of a delay. To talk about our current status, I started on October 2nd and have made pursuing accreditation a top priority. I've completed all the required training, and we were able to submit an online registration, which is sort of that first main step, and that allowed us to pursue an application. We've also had an accreditation team meeting on 10/19 to kind of restart and refresh that documentation gathering process. The team was really positive, and we're excited to kind of get back to work. I wanted to present to you a revised timeline. So some of these items have already been accomplished. The application is complete, just pending a letter that it looks like is signed. So thank you for that. Once we submit that, our application will be complete, and shortly thereafter, they'll submit a request for us to provide payment for accreditation. And once we do give that payment, then I'll be scheduled to attend an in-person training. And they kind of have some preset dates on that. So it looks like I'll be scheduled for that February 13-14 training. And then once that training's complete, they'll allow us access to the online system to start uploading that documentation. And our documentation uploads should be complete by October 1st of 2018, so about a year from now. Once all the documentation has been submitted and reviewed, the accreditation board will schedule a site visit. That's a 2-day-long site visit where they come and take a look at the actual facility and check to make sure all the documentation that we submitted is fully implemented and in place. Once the site visit is complete, the accreditation committee drafts a report. They put that report forward to the committee, who makes a decision to either accredit us or to let us know that we were not accredited and provide us with an option to submit an action plan to address any shortcomings that they may have identified. So with that, I'll take any questions.
Thank you so much, Ms. Peters. Does anybody have any questions? I'm sad to see that Dr. Novak isn't here, and I hope you get a chance to interface with him, because he really is the cheerleader for accreditation. And he has a national position on the National Association of Local Boards of Health, so I think he's going to be a great help for you as well. He brought this back from a conference and said we have to pursue it, And we kept saying, we don't have enough money, and what is this going to do for us? And then he's convinced the board that this is a good policy for us. So I encourage you to meet with him along with the district health officers so that he can help you with the cheerleading.
Sounds great. Thank you.
Thanks, Ms. Peters.
Can we have the board accept the?
Oh, yes, we need the board to accept this progress report and timeline.
Move to accept the timeline and the progress report.
I have a motion by Brown, second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 13, presentation, non-action of the Excella Regional Licensing and Permitting Project, and where we are in that position. And I have Ms. Albee and Mr. English here to present.
Good afternoon, Madam Chair and members of the board. For the record, Charlene Albee, I'm the Director of the Air Quality Management Division. At the last District Board of Health meeting, Dr. Novak had requested an update on the status of the Excella project, and once again, I'm glad he reads his packet and hopefully we'll get the answers to his questions, but we were happy to put this together. I think that in my 20-some-odd years that I've been here, this has been the largest regional project I've ever been associated with. The last major overhaul we had in our permitting program was Permits Plus that was implemented back in 2000, 2001, but that truly was just county. That was the Washoe County. And this going regional has taken that to exponential lengths. The report today, I provided the positives first. I think that when we are in the trenches every single day, which is, I think we can agree, staff is in the trenches every single day just trying to work through it, we lose sight of where we've come from. And so I wanted to highlight what we have done. In addition to thousands, literally thousands of permit records being brought over from our old system and converted into the new system, we've worked through those challenges for renewing those permits for restaurants and businesses and things like that. But we've also had to start new businesses. We've had new activities coming in. So the table in front of you on the staff report on page 2 highlights some of the major accomplishments of permit volumes that we have seen, and these are truly just new permits from January 1st to the end of September. So over a 9-month period, we've had, just to highlight, 1,000 asbestos assessment and abatement projects, 6,000 wood stove notifications and certificates. So over a 9-month period, those are huge numbers. The EHS food events have 926, that's almost 1,000. When you think that the special events season is condensed, that's even in a less amount of time than 9 months. So 500 food permits. These are big numbers, and I think that we don't give staff enough credit for how far we've come and what we've worked through. The first 2 months of Excella, we went live October 31st of last year, so we're coming up on our 1-year anniversary. The first 2 months of this was brutal. It was painful. There were, I can honestly say, tears in every office that was dealing with this, just because of the frustration level that you have such a dedicated staff that wants to provide good customer service, and they literally were trying to do it blindfolded with one arm tied behind their back. And I think from that point where we started to where we are today, we are now polishing the product. We are getting work out. We are able to function. We're able to provide customer service. We now have more and more customers using the Citizen Access Portal. It is being accepted, it's being refined, it's moving forward, and it's in a lot better shape than it was before. We actually can get through a day thinking we did something good and we made it better and we are successful. A lot of the credit on this has to go to frontline staff and working with tech services. For air quality, the Excella staff did a lot of our build. For a lot of the other programs, I'll let Jim speak to EHS, but there was a lot of consultants coming in, but it really is dependent on frontline staff showing what business practices need to be built in so that they can do their job and provide the customer service. Tech services has been wonderful. I think that even they have gotten from the point of having to deal with the elephant to now coming down and we're having weekly meetings with staff one-on-one. This is our list of issues, this is our priorities, and every week you see that list get checked off. I won't say it gets smaller because as we get deeper and deeper we find more things, but the list of issues is revolving. It's not the same ones just beating us on the head. The biggest list we have, issues, I just highlighted them here in the report. One of the things that's really interesting that we still are trying to work out, the health district staff has worked on this. Our tech services has worked on it. It's now up to Excella's Customer Resource Center. We don't know why the health module cannot print a receipt on the citizen access side. It's interesting. There's a configuration in there somewhere that through these thousands of lines of code, everybody's trying to figure this out. So an example of how we're working together is Tech Services has come up with and is in the final stages of testing that when a citizen goes on and makes a payment online, instead of being able to print their receipt like we would hope they would, it's actually going to send them an automatically generated email that will have the receipt printed from the back of the house attached to it. So those are the kind of workarounds that we're getting to, that at least we know the customer service is getting there, so that can continue on while we try to fix the real issues. There's a lot of work going on right now in the plan review workflow process. That's working with all the other agencies to try to make sure that we have consistent processing for each Reno, Sparks, and Washoe County plans, and that we don't have any falling into the abyss, because that's the absolute worst thing that we could have happen. So that's coming along. We're still having a challenge with the mobile office for field inspectors to go out and do their work and provide the required documentation through NRS. So we're working on that. Accurate collection of fees. The air quality renewals, we're having a problem actually calculating the fees correctly. So there's a lot of manual work going on right now to make sure they are going out the door correctly. Hopefully the automation of that is going to be corrected here shortly. And the last thing that's come up is the internal controls for audit purposes on the finances. We've got business practices in place so that we can ensure that those are in compliance for audit procedures, but the look is now setting up the system so that it can have these controls automated, and that's the challenge that's has actually been elevated to the treasurer, comptroller, and internal auditor level, so we'll get all of them involved. So, and now I was going to let Jim English come up and give you some updates on the environmental health progress.
Great.
For the record, Jim English, the only thing I'd really like to add is I'd like to thank Steve Fisher from Administrative Health Services for his contribution to the EHS side of Acela. He did some of the build. As Charlene said, we also had TS working for us, and we used third-party consultants. TruePoint was one. We're currently looking at using TruePoint and Burn to do some additional work going forward. And EHS right now is in the process of fine-tuning some of the record types in Acela workflows, and then adding some of the permit types and activities that we currently never had in Permits Plus or the system before that, CR Permits, so that everything we do will be inside Acela and will be automated and fully transparent.
Great. I want to commend you and staff, and I hear your frustration, and I want you to know that frustration is regional. I've had sit-downs with Reno and Sparks staff pulling their hair out, and I think we were sold a bill of goods that they couldn't, produce for us, and really relied heavily on staff to do this implementation, while the staff at the same time had to do their regular job. So I want you to know that's universal, and we don't know what we're going to do at this point, and it's sort of like, I think we're stuck with it. unless we can get a good lawyer and get out of it and get some damages out of that. But I thank you so much, and please let the staff know that we at least I do know, and I have been kept apprised of this, and this has been probably one of the worst years for staff because of all of this extra burden for a clunky piece of software.
I appreciate that, and I know that they appreciate the recognition too. So we will continue to battle on and come to work every day and do the best job we can with what we've got. And I do say with cautious optimism, things are a lot better.
Great.
And I think that we have some positive directions coming.
That sounds good. Any other comments or questions?
I just wanted to comment that I think that oftentimes I ask myself, how am I going to do this? But then after a while, you say, why am I doing this? And this sounds like one of these programs like that, too. But I do, I appreciate you guys because you do like challenges, and thank God you like challenges.
Yep, that's a public servant for you. I
There you
appreciate
go.
you. Yep,
All right.
absolutely. Any other? Okay, thanks, both of
Alrighty.
you.
Thank you.
And also, if you have some ideas for something else, bring them to us, from your committee or your team, and tell us what it's going to cost and what the regional share would be if that is where we're at. Because I don't know how much longer we can go if we're going to keep having a litany. I mean, not being able to print a receipt is the most ridiculous thing I've ever heard of when we're looking at the permitting process. So just, you don't need to say anything about it right now, but just kind of keep that in mind and go back to your committee and say, when is the point that we will pull the plug?
Well, I don't know that at this level we're going to be making that decision, but I can tell you that we are looking at things like add-ons, which is software that will actually sit on top of the Excella Citizen Access page
Okay.
to act as more like a tutorial to help walk you through the process. There are some costs involved with those, and we'll deal with cost when we get there because we all realize its functionality at this point.
Absolutely.
So there is a lot of work through the regional coordinating team looking at some of these add-ons that will make life easier for all of us. So.
Okay, great. Thank you very much. All right. Item number 14. I'm sure you dug deep into the wording of this. This is the review, approve, and adopt the proposed Washoe County Health District Employee Policy Manual updates for fiscal year 18. Does anybody have any questions or comments? Ms. Griffey, would you like to state anything for the record or let the record stand?
Oh, this is Lori Griffey, HR rep for the Health Department. It's just a policy that we update every 2 years. We bring it to you for your approval, and then we send it out to our employees.
Okay. Any questions? What about District Health Officer? You have any concerns or?
No, there have been some updates to the policy. I think it just continues to improve as people look at it and find areas to fine tune. We had legal. Ms. Admirand reviewed it as well. I guess one of the significant things that we have is an update to our personal appearance policy. So we've got some. Before it was a little looser and judgment-based, and I think we've strengthened it a lot more so that it's clearer to employees what's acceptable and what isn't, and it's easier for supervisors to deal with situations if we have them. So
I think that's great and something that, as you know, at different retreats that I've complained about, most especially because we have staff wear their IDs everywhere for safety, and even staff that are not forward-facing. I mean, I've seen people in flip-flops and pajamas. And I believe that as a tax-funded employee, you are buying more grace for when inevitably one of us messes up if we always look professional. But when we don't look like we're at work, the people that are our customers and our taxpayers don't have faith in us anymore. So I think that's just the easiest way to build some community relations. And listen, sometimes I come into this office looking like a hot mess, but I don't wear my ID then. And I'm just popping in and popping out. I'm not dealing with any customers or so. Please don't judge me when I'm saying this. I just feel like you're preserving your own dignity and the dignity of this organization and really the dignity of all people who collect a salary based on taxpayers. So, and maybe I'm old-fashioned. My mom always says if you dress nice, you're going to act nice. So I will entertain a motion for this.
I move for approval.
I'll second that. I have a motion by Young, second by Jung. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Thanks, Ms. Griffey. Item number 15, this is the review and approval of the district health officer's annual performance evaluation results and possible approval of a 1.62% wage increase retroactive to his annual evaluation date of October 24th, 2017. And this is my presentation. You do have a yeah, you have here we go. You have a staff report that does go through and give you a snapshot of the rankings of our district health officer. Let's go through it. I mean, where do you want to start? Do you have any concerns? I don't know if I need to read the whole thing to you, but I am a good reader, if you want me to read. Did anything jump out? Do you have any feedback or based on what you saw in this evaluation? I can tell you right now, the leadership response date at number 1, best DHO we've had in over 10 years. That's my comment. So you kind of know where I stand on this district health officer. As I said before, we would hire physicians who treated us like a part-time job, and we'd never see them, and we paid way more for them, and we really needed somebody that knew how to come in and do organizational effectiveness, frankly, and who was a good administrator, not a good physician. And we get him for cheaper, because he doesn't hold an MD. And as you notice, we've had no issues with that. So I feel like MDs have turned this into some certain craft that they do in retirement, because all 2 we had before you had the same MO and how they did this job. They didn't even live here. So, and we do have a doctor on staff that is a contract that can handle those things that a non-MD couldn't handle. So I want you to just know sort of where I come from. And then I'm going to tell you, too, I have a real problem, and I hope they're watching because I don't know who it is. But somebody for question 5 on October 4th said, the water projects issue is a current example of the need to improve communications in intergovernmental relations. I'm always a big believer in improving communications and relations. They go on to further say, the health district is a support mechanism for local governments. No, we're not. We stand on our own per NRS, and we are certainly not supportive. And in many ways, we are the bureaucratic red tape that sometimes gets in the way of good business, but most importantly, our number 1 goal is the health of this public and not to facilitate other government entities, including Washoe County Commission. So, and so this person goes on to say that we're supposed to support them and that we are not the agency defining regional public policy. We just read NAC and NRS and what the Department of Environmental Protection and the State Board of Health tells us. We don't in any way define regional public policy. That would be a far reach for us, and there is no way that anybody can give me an example that we have, because we don't have that kind of authority. So I just want to set that on the record, and if that person would like to call me and have a conversation, I'd appreciate it, because we are not here to support other governmental entities. Any other comments or suggestions or solutions? I think it's great. I think there will always be twisted people that fill it out in a bad mood or had a bad experience. If you would be so kind, Mr. District Health Officer, to accept that 1.62%. The reason why that's so meager is he's at his cap now, but he's worth every penny of that. So if I may make the motion that we approve the wage increase retroactive and that he stays around for some more time.
I second that motion.
Okay, motion by Jung, second by Delgado, but I do have public comment. Miss Kathy Brandhorst, this is item 15.
My name is Kathy Brandhorst, and I am the United States President. I just wanted to let you know the health the Washoe County Health District. They're not doing their jobs. You said that they would get a raise on these, on this item. It's not going to happen, because most of the time you walk in, you say, "I'm hired." We've never seen you before, but you have been hired. You're stealing payroll checks. You're stealing other people's jobs. You're clinging against other people because you don't have the income. You don't have even a job, but you're going to steal from other people to say that you have the job, and you do not. You never have been hired at all. This has not been stopped at all. It's still going on in this Washoe County, and I don't know who's going to stop it. Because if you have never been hired, why are you behind the desk? Why are you here at the Washoe County? Why are you doing this to other people? They are homeless right now, and they say they do work here at the Washoe County, but they are now victims, and they can't even get their payroll check. They can't even get onto the Social Security because they work here. And you don't really realize that some of them do have families, and those children are underneath those blankets right now at the mission. The mission is full. And when I asked if I could get off the street, they said, "I'm sorry, you'll have to sleep outside with the rest of them. There's no room in the mission at all. It's full." They're still serving breakfast from 8 to 8:30. 9 is the last of the meal for breakfast. Also, I just wanted to mention they do serve dinner at 5 o'clock and 5:30 for the men. And they still do this. But I just wanted to mention too, I've been staying at the senior center for lunch, and I noticed my number was 272. Oh my. What does that mean? Well, we're still having troubles with the people who come from Sioux Falls, South Dakota. I got in the line in Sioux Falls, South Dakota, and I
Ms.
couldn't
Brandhorst.
find the end.
Okay, we have a motion by Jung, a second by Delgado. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Congratulations.
If I could just comment.
He has a comment.
Thank you. I just thank you very much. It's my privilege to serve the board and our community, and to have the opportunity to work with the excellent staff that we have at the health district. I did want to just follow up on some of the, so there was a 360 survey that was done, and under the District Board of Health Relations, there were a couple of items where it's not clear whether it was board members responding or others, because 21 people responded to the survey, and it's anonymous as to who is who. So I just wanted to ask the board that if any of the board members responded as an area of improvement for me as far as responds well to requests, advice, and constructive criticism, or facilitates the board decision-making without usurping authority. Those were two areas where there were some people that said areas for improvement. I would just request if any of those were board members, please follow up with me to let me know if any concerns that you've got in that area.
Yeah, it's incumbent that you do, because otherwise he can't fix what he doesn't know is broke. So I would appreciate that as well. Thank you, Mr. District Health Officer. We're moving to item 16, which are non-action items. Staff reports and program updates. Item 16A is air quality management. Ms. Albee, do you have anything to add to your report?
Again, good afternoon, Madam Chair, members of the board. We actually do have an event that's going on right now that has just surfaced. Yesterday and a couple days before, the Truckee Meadows Fire Protection District issued a press release letting the public know that there will not be any open burning this year due to the fire hazards. We have a burn season that for air quality, open burning is allowed. We've gotten to the point where there's such a small window when it's the prime opportunity for air quality and fire to burn in that period, that it just has really become difficult over the years. We've been trying different practices and permitting programs and everything. Last year, the Truckee Meadows Fire responded to 12 escape fires from controlled burns on people's residences. And the fuels that we have out there this year, that's just really extreme. We just can't run the risk. I think that Santa Rosa's proven that it's really, we need to get a mindset change, that it's not, I need to burn the brush that's around my house for my defensible space. It's, I need to remove it, and I need to put it someplace else. So they're actually doing a green waste recovery that it's a pilot project, see how it works, see if the locations they have out will work, and then they're going to be utilizing what's called an air curtain incinerator. It's a slang as a burn box. The challenge that air quality is now facing is to try to get a permit to operate on this. These type of devices, for reasons unknown to anybody that I can find can tell me why, are actually specifically identified in the federal regulations, new source performance standards, requiring a Title V permit. That's our federal oversight permit. The typical application fee for that is in excess of $30,000. And if it's a major facility like a power plant or a major manufacturing facility, we have done the cost analysis to justify the efforts to go into that. That is cost prohibitive for something like this. Burn boxes are portable, they're not stationary sources. We have been on the phone to Region 9 EPA, and they agree that it's really a difficult situation. They don't even know why it's been addressed this way. So what we've done is we've worked out through Region 9 a way to issue a general Title V permit that will be specifically for air curtain incinerators, so that anybody, any land manager that wants to come in and operate one of these, or a construction company for that matter that has a large area they want to clear, they could actually rent and operate one of these. We are still going to have to go through public notice, public hearings. The board will have to adopt the general permit. The other part of that is we are going to come back to you with a new fee that will be more representative of the cost to manage those permits following the application. I can't tell you at this point in time what that is, what the fee is going to be, but we have been directed to go ahead and have Truckee Meadows Fire submit their application for a local district permit. Once they turn that machine on the first day of operation, that starts the clock, that they have 1 year to submit the application for that Title V permit. And we're confident that we will have everything in place before that 1 year anniversary, so that then they can flip it over into a general permit and then just go to the required reporting and compliance conditions at that point. These are kind of a new device. They've been around for a while, but they're really not mainstream. So I do have a video here that hopefully will give you an idea what it is that we're talking about.
Airburner's portable firebox model S217 is shown here in full operation at a land clearing site in Florida. See the puff of smoke that's produced as the wood waste is loaded inside? That's because the air curtain has been broken. But then you notice how quickly the smoke stops. The air curtain has now closed over the top, trapping most of the particulates, including smoke, inside. Here we're looking down from above the Airburner's portable S217 air curtain burner in full operation. A high-velocity curtain of air is covering the top of the firebox, running from left to right. The curtain has the same effect as a lid, trapping most particulates such as smoke inside. Also, because air is forced into the firebox, an extremely high temperature is created. This results in a much faster and cleaner burn.
So the video there was actually shot down in Florida. These type of devices are used for cleanup after hurricanes and natural disasters where you have a large amount of debris that you need to get rid of quickly. The federal regulations did provide an exemption from the Title V permit if the governor had declared a state of emergency. We are not really in a position that I would feel comfortable going to the governor to ask him for that declaration. However, the state of California did have their governor declare state of emergency because of the condition of their forests. It took 2 years to get from that declaration to EPA acknowledging it and allowing for the operation of these on the other side of the hill. We thought, in talking with Region 9, that this general permit would be a better way to go. It's going to be a lot more efficient. It'll be a lot more cost-effective for everybody involved, and we will be coming back to you for your approval once we get a final permit and fee. And I'm available if there's any other questions.
Thank you very much, Ms. Albee. Does anybody have any questions or comments?
I'd just like to say, you know, I've worked with these burners and organizations, usually at the federal site, when there's disasters, as you mentioned. And to have Truckee Meadows bring this forward, I think shows they're a leader in the industry here in Washoe County, assisting with the removal of fuels, both in our communities and surrounding. You mentioned the forest. You know, we look at the forest as one of the biggest settings, but our deserts are there as well. And we have to have a way to get those fuels removed, and then a clean way to get rid of them. And this is a great way. You know, biomass is something we talk about time and time again. We just don't have the facilities and able to move them. And I got to say again, thanks to Chief Moore and the staff for bringing this forward, because I think it's really going to help our county, and it's going to set us as a leader in the industry again. So I think that from the health district side, I'm glad to see we're working as hard as we are with the staff of the district health officer and those employees that are very familiar with this to make it happen. So thank you, Charlie.
I would like to add that this is, there are some of these operating under general permits in the country. Arizona's got one down in Maricopa County. Texas has got some. But this will be one of the first general permits that Region 9 is in close proximity to. And so they did request that once it's ready to go and operate, they are wanting to come over and look at it. So
Great.
they were actually very excited about coming over and seeing it. So
That's great.
it shows the partnership that we have with them is really beneficial in times like this.
Certainly. Any other questions, District Health Officer?
I just wanted to add that, you know, Charlene has laid out a process that we'd go through to come up with a new permit fee, which is going to be substantially less than the type of permit that we had previously, Title V permit that we had put our fee together for was an industrial permit, and this one's going to be very simple. But there's a process to go through there, and so I just wanted to put on the record, we've got Chief Moore here in the back being told, you know, he's got a year that he's got to get his application in. I don't see any reason why we can't get this new fee set up, but in the event that we don't, I would certainly come to the board asking for deferral of assessing any fee on that application if we still need work to do to get that fee established. So.
Great. I think it's wonderful. Thank you very much, Ms. Albee, and I look forward to this new burn box. Thank you. 16B, Community and Clinical Health Services. Mr. Cutts, do you have anything to add?
I have nothing further to add. I would be happy to answer any questions you may have.
Does anybody have any specific questions for the Community and Clinical Health Services Director? Thank you. 16C, Environmental Health Services. Kevin Dick is our acting director. Do you have anything to add?
I do not.
Okay. Does anybody have any questions for him from that report? Thank you. Item 16D is Epidemiology and Public Health Preparedness. Dr. Randall Todd has something to add.
Good afternoon, Randall Todd for the record. I have just a couple of updates from my written report. One having to do with the ongoing outbreak of aseptic meningitis. We are now up to 42 confirmed cases. So this seems to just keep trickling along. We have gotten the virus, the specific virus identified. It's an echovirus 30. And this is the same echovirus 30 that is causing the outbreak up in Lassen County. So there are some demographic differences between their outbreak and ours. We're still not entirely sure what the connection is, but we think based on the similarity of the viruses that there likely is one. So that's going along. About 75% of our cases are in children and 60% are in school-age children. So that's the update on the aseptic meningitis. And then just very briefly.
Dr. Todd?
Yes.
Could you explain to the people that are watching what the symptoms are of aseptic meningitis?
Sure. So aseptic simply means it's not bacterial. And in this
So it's a
particular,
viral?
it's a virus that's causing it. You can have aseptic meningitis that's due to other things, but in this case, it's a viral meningitis.
Okay.
And symptoms would include such things as fever, headache, stiff neck, being sensitive to bright light, being sleepy or having trouble waking up from sleep, nausea, vomiting, lack of appetite, lethargy, or lack of energy. So they're kind of generic.
Flu, like?
Well, it'd be a
stiff
really
neck.
bad, a
Oh,
really
bad flu, okay.
Yeah. So, yeah, that's.
And so it is communicable because it is a virus.
It is a virus, and yes, so you would want to, what we recommend for prevention is that people pay attention to hygiene, so hand washing becomes very important, particularly as we're in this Halloween area, or Halloween time, where people may be getting candy and other treats that are handed to them by hand. That could be a problem. Also with sporting events, sometimes there are events that happen in conjunction with those, such as dances and so forth.
Sure.
So there may be boys and girls that like to exchange saliva, and
Never heard of
that
that.
could be a problem.
Is it deadly? Because when I went to college, a college girl got spinal meningitis, and they cut off her arms and legs.
Okay, so viral meningitis is generally something that you get over.
Okay.
Bacterial meningitis is the one that can be deadly at
Okay.
times.
Thank you. Go on with your report.
So the other update that I have is regarding the valley fever, or coccidioidomycosis. And we haven't had any additional cases, so we're holding at 18, although that's double our previous high number. And I think I reported last time, and it's, in fact, it says in this month's board report that we are awaiting test results. So CDC came out and helped us do some environmental testing. We were hoping that we would be able to find evidence of the virus in the soil, or not the virus, the fungus in the soil. We collected samples. They have been analyzed at CDC, and unfortunately, they all came back negative. That was not a huge surprise, although it is a little bit disappointing, because we're fairly certain that it is here, but it is extremely difficult to find in the environment.
Great.
And with
You've
that,
been busy.
I would entertain any questions the board may have.
Any questions? Thank you, Dr. Todd. Item 16E is the Office of the District Health Officer. Kevin Dick, do you have anything to add to your report?
I just wanted to let the board know that we did have a meeting with the Builders Association of Northern Nevada on October 19th. Actually, some representatives from the Southern Nevada Home Builders Association also attended that meeting, along with TUMWA, the NDEP administrator, and representatives of the local municipalities. At that point, we discussed with them issues around water project review, identified the areas that we've worked on for streamlining and improving that review process, and also discussed the issues that remain with NAC and the potential for revisions to be made. NDEP is willing to work together on looking at revisions to NAC 445A, and asked the Builders Association to put together a work group. We asked for issues and to discuss, and there were a number of things that were identified. But what we found is we were talking through those. It seemed that most were issues that were months old, that were remaining on people's minds, but that had already been addressed by actions that we have taken. We had a meeting scheduled with the City of Reno representatives that didn't occur last Friday. And there's a concurrent meeting that's scheduled for November 6th, and I expect the agenda to be posted on Monday for that, to include an item, presentation, discussion, and possible action on the status of the review and approval of water projects by the Truckee Meadows Water Authority, Washoe County Health District and/or the Nevada Department of Environmental Protection. So I will be presenting there with Mr. Lovato, the NDEP administrator, and Mr. Forey with Truckee Meadows Water Authority. Believe I've attempted to keep the board well briefed on the water project issues and what we're doing with it, but I'm available to anybody that wants to discuss that. I'm very pleased with the next item that I wanted to highlight, in that we will have a new Environmental Health Services Division Director next week, Mr. Chad Westham, who will be joining us, coming from the Nevada Division of Public and Behavioral Health, where he's been serving as a bureau chief, and formerly, before his promotion, was the head of the environmental health program there. So he will be joining us for the strategic planning retreat on November 2nd. We'll introduce him that morning. And then I also wanted to highlight work that we did along with Truckee Meadows Healthy Communities to support the remote area medical RAM event that was held September 29th through October 1st. Through that, and the volunteers that worked with us to provide services using the RAM infrastructure that they brought, we served 430 patients.
Wow.
A total benefit of over $137,000. So Christopher Dare, board member Dare, volunteered and participated at that. It was one of the many volunteers that we had. People that were really in need, receiving multiple extractions, eye care services, other services there at the event. So not only was it something that helped to improve the health of individuals within our community, but also alleviating pain and suffering that people were experiencing on a daily basis.
Absolutely.
So I wanted to recognize, actually, Felisa Hillard, Rayana Dixon on my staff, and Robert Forrest, who we had hired, had been working with chronic disease, and we continue to as an intermittent hourly for the tremendous work they did in helping to organize that event. Thank you.
Yes, Councilman Delgado.
Thank you, Madam Chair. Quick question, Mr. Dick. For those that went to the RAM events, how did we refer them to other, if they needed ongoing help? Who were they referred to, say, primary care at Renown or St. Mary's or other providers in the community, and how did that work out?
Yeah, thank you for that question. We actually had both Northern Nevada Hopes and the Community Health Alliance offer for follow-up care for individuals that came to that event.
Okay.
So there was generous offers of support following the event, which we very much appreciate.
And last question, I think, as Chairwoman Jung had stated earlier regarding dental, we had dental providers there. How many would you say, maybe estimation in terms of local providers versus, I know there are some that even came from out of state?
Mm-hmm.
Yeah, we did have a few local providers, and frankly, I was disappointed that we didn't have more local providers for both the dental and the eye care services. Actually, the first day of the event, we had one optometrist that I believe was from Connecticut that had traveled out for the event. And we did have a few more on local, but we had done quite a lot of outreach through the Dental Society and the Optometry Association to try to get people to sign up for that. If we had had more patients, we would not have had enough caregivers there for them.
Yeah.
Thanks.
Yeah, the hope is to get some more locals involved, but
Yep.
thank you again, Mr. Dick.
Thanks.
To your staff.
Thank you. Maybe we're going to have to shame some of these local providers into giving back to their community. All right. Any other questions for the district health officer's report? That takes us to 17, review, discussion, and possible direction to cancel the Washoe County District Board of Health meeting currently scheduled for November 16th, and this is an action item. Mr. Dick, do you want to explain the situation we're in?
Yes, I actually contacted the chair on this because in The way we scheduled the meetings to accommodate the holidays, we've got a couple of different board meetings that are coming at us in very quick succession. So the meeting that we had scheduled in November on the 16th, between now and then, we're going to be having our retreat on November 2nd. Our timeline for getting a board packet together is we basically have to have our reports available for Ms. Rogers to develop that next Friday, November 3rd. So to me, it doesn't make a whole lot of sense to try to do the November meeting because our December meeting is coming up very quickly because of where Christmas falls. It's going to be on December 14th. So my recommendation was to add this to the agenda and let this is certainly the board's decision, and I'd be happy to support a November 16th meeting, but my recommendation is to look at those dates and consider canceling the 16th, November 16th meeting.
What are you guys okay with that? Okay, I will need a motion.
I move that we cancel November's meeting.
I have a motion by Young, a second by Brown. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. That takes us to item 18, which is board comment. I will start to my left. Chief Brown, do you have anything? Councilman Delgado? Mr. Young?
My only comment is I've been meeting with lots of the staff here in the health department too, and I'm just incredibly impressed with the quality of people and the dedication we have here. And I really do want to, publicly say that I truly believe this is an incredibly good staff, and I raffle any place else in the nation to match the dedication of what we have here.
Absolutely, I agree 100%. I have a couple of things. The picnic pub issue, I would like to get an update, and let's have the whole board updated. And then I also want staff to look at the evolution of governments in terms of us being responsive to changes in business models that we can anticipate with the millennials, who, by the way, are bigger than the baby boomers. So we should start looking across the nation saying, what can we anticipate people are going to come in for, permitting, and how have other counties been able, and boards of health, been able to accommodate them to make sure that the public health is protected. So that's one that I would like. And then I just want to thank Chief Moore, who came today and now is gone, because some people had said, well, why isn't he at the meetings? Well, he can watch our meetings from his office, first of all. He's right here in the building across the way. Of course, this is the only meeting that other fire chiefs aren't here either. So some people treat it like a competition, so I get asked why he's not there, and then I told him that it was important, and then here he is, and nobody even got to see it. So thank you, Chief Moore. I know you're listening. Okay, my final, if nobody else has a comment, my final public comment is now open, and I have one person signed in, and that's Kathy Brandhorst. This needs to go all back to Laura. Give this all to Laura. Okay.
Again, my name is Kathy Brandhorst, and I am the United States President. I just wanted to tell you, I have left C Street. I have left the apartment with Scotty, and he is the owner of that apartment. He lives there. But unfortunately, he says he's had so much problem trying to get himself to stay there at the apartment. They have dragged him out of the apartment, stabbing him. He does have stab wounds, and that's when the part of the REMSA and the ambulance had to pick him up. He seems that he just doesn't want to stay there, period. And he has been trying to fly the apartment out, but somebody always stops that apartment from flying out of the lot. And these people have stopped it, and he's had it on its way out one morning, and unfortunately, it came back again after he had planted it someplace else and into a different lot in a different place. So he could use some help if somebody can help him get the apartment out. But please remember that stuff is mine and it belongs to me, and I could not find a place yet, to take all my stuff out of there. And it has been a worry because I don't know if all my stuff is going to be there by the time I get ready to move. I just wanted to let you know, the neighbors on that property next door, I tried to explain this to other people too, that they are drunks, alcoholics, they're high on drugs, they're high on illegal drugs is what it is. They will kill, they will murder, they don't care what the body's going to look like by the time they are finished with the body. They are not human. They turn into snakes, salamanders, and other type of animals that hang on my wall. I just wanted to tell you that these people do murder anybody in the alley. That's how they drag them out of the alley and drag them right to their home, and they are tortured to death. It's the U.S. military. And it's very crucial, that they cannot be there, they cannot live there, they are not human.
Thank you very much, Ms. Brandhorst. There is no other public comment, so therefore we are adjourned. Thank you, everyone. Did that sound heavy? Oh, I didn't hit it that hard. You should have been when Humpy